Hi, my name is Elliot Crawford, and I'll be talking to you today about the opioid crisis in the United States. Our objectives today: the learner will be able to define an opioid crisis or opioid epidemic. The learner will be able to describe what an opioid is and be able to identify examples of opioids. The learner will be able to discuss the origins of the opioid epidemic. The learner will be able to list current statistics regarding the opioid crisis and will be able to explain the urgency of the crisis. The learner will be able to identify and explain different methods to combat the opioid crisis. The opioid crisis or opioid epidemic is defined as the rapid increase in the use of prescription and non-prescription opioid drugs in the United States and Canada, beginning in the late 1990s and continuing throughout the next few decades. An opioid is defined as any synthetic narcotic that has opiate-like activities but is not derived from opium. A few examples are oxycodone, morphine, Vicodin, Percocet, Demerol, and heroin. The opioid crisis started in the 1990s when pharmaceutical companies assured physicians that pain medication would not be addictive. Oxycodone and hydrocodone were popular medications prescribed for chronic pain. Drug companies assured doctors and congressional investigators that this was okay, and so it became routine care. Doctors were convinced that these drugs had few risks, which led to an increase in prescription of opioids and then increase in misuse and addiction of prescription and non-prescription opioids. In the late 1990s, more than 1/3 of Americans were diagnosed with chronic pain. This led to an increase in prescription opioids being misused and or abused. This further led to an increase in tolerance and an increase in addiction. Pill mills and pain clinics popped up everywhere. Professionals became the drug dealers and lab coats. DEA agent Joe Renazisi describes it as a distributor's representative told us the problem is not distributors but doctors who overprescribe pain medication. But the distributors know exactly how many pills go to every drugstore and they supply. And they are required under the Controlled Substances Act to report and stop what the DEA calls suspicious orders, such as unusually large or frequent shipments of opioids. But DEA investigators say many distributors ignore that requirement. This further led to the epidemic. Ex-DEA agent Joe Renazisi turned a whistleblower against some of our government officials. He states, this is an industry that allowed millions and millions of drugs to go into bad pharmacies and doctors' offices that distributed them out to people who had no legitimate use for those drugs. These are some 2016 opioid statistics. 116 people died every day from opioid-related drug overdoses. 170,000 people used heroin for the first time. Over 15,000 people died from a heroin overdose. 2.1 million people misused prescription opioids for the first time that year. Over 19,000 people died from an overdose on synthetic opioids, excluding methadone. An estimated of $78.5 billion per year were spent in healthcare, criminal justice, and addiction treatment costs because of an opioid abuse. Opioid overdosing is the leading cause of death in the United States. This continues to increase among women and men of all ages and races. The opioid epidemic was declared a public health emergency in 2017 by President Donald Trump. He states, "Together we will face this challenge as a national family with conviction, with unity, and with a commitment to love and support our neighbors in times of dire need. Working together, we will defeat this opioid epidemic." This further just shows that no one is immune to opioid addictions. Opioid-related facilities have multiplied in the last 20 years. These facilities help promote and implement programs to prevent and treat opioid addictions. The CDC created safer prescribing guidelines for states to adopt. These create tighter regulations for the way opioids are prescribed, allow for better long-term treatment of chronic pain, and decrease the amount of misuse and overdose of opioids. Prescription drugs take-back programs allow for a safe, convenient way of disposal. Deterra pouches. These are pouches that deactivate the drugs, making them unable to be misused and safe for disposal. And even some local pharmacies will sponsor a take-back day where you can bring your expired or unused medications for proper disposal. An increase in public education and awareness. In the last few years, 81 pieces of legislation have been introduced by Congress. Most of these focus on 5 main points: increased funding, additional prescribing regulations, more regulations for for the manufacturing and selling of opioids, increased criminal penalties for non-prescription use of opioids, and better control over pharmaceutical imports. Prescription drug monitoring programs. A database is utilized by the government and physicians to monitor who is prescribing and receiving certain medications such as opioids and other controlled substances. Even some states have adopted a program for naloxone distribution and training. Naloxone is also known as Narcan, and it's the antidote for an overdose. Many states have begun allowing pharmacies to dispense naloxone without a prescription to help combat the rate and increase in opioid overdoses. Individuals are trained in the administration of this. And then these are my resources. Thank y'all.